Thank you very much, Harry. Come on over and join us because it is time for this morning's Ask It Early. Our own Dr. Jennifer Ashton is here to answer your medical questions. And good morning again for the third time. Fourth or fifth or sixth time.
Pleasure to be here.
Okay, we have some good questions for you. The first one comes from Jonathan in Erie, Pennsylvania, and he is on Skype. Jonathan, are you there?
Yes. Hi. Good morning, everybody.
Hi. What's your question?
Hi. It's always a pleasure to be back on. As an osteopathic medical student and future osteopathic physician, patients often ask me whether or not it is healthy to limit the amount of food you eat and therefore your daily caloric intake as long as you still satisfy the daily nutritional requirements with high-quality vitamins and supplements in order to lose weight. How do you suggest that I answer that question? Thank you.
Is John a TV anchor?
I know. Did you get the question?
He does medical school on the side. But here's the thing that people have to understand when you're talking about a multivitamin or any kind of vitamin or mineral supplementation. It is not a substitute for eating. The preference is to get your food actually by eating food. However, we should mention that's exactly right. Sorry,
get your vitamins by eating food.
But we should mention that you can't eat enough food to get the actual amounts of vitamins and minerals that you need, even if you eat a well-balanced diet. So for many people, those who are pregnant, those who have an underlying medical condition, those who have absorption or nutritional issues, yes, a multivitamin is fine.
All right, Jonathan, there you go. Thank you so much.
Thank you. Always a pleasure.
Our pleasure. Now we have Kim who twittered this question, Jen. Does carpal tunnel start as a tingling and slight numbness in the hand? And if this goes untreated, can the nerve or muscle be damaged?
Ooh, good question.
Yeah. Now, carpal tunnel is a very common problem. It affects millions of people every year. And it's caused by a compression of the median nerve in the wrist. I'm going to show in Russ's hand. Okay. This area here on the hand normally gets very painful. The pain can go up your arm, and it can, if not treated, cause actual muscle weakening. You can think of this like a garden hose that gets stepped on. If the water can't go through, the blood supply can't supply that nerve, then yes, you can have muscle weakness and atrophy. A lot of different treatments. The easiest one is just a simple splint or immobilization that you can do at night before you go.
But it's not tingling.
Neuropathic pain, it can start as tingling, but neuropathic pain that's caused by nerves, extraordinarily painful.
Right. Okay. So many people suffer for that.
Yep,
That's
absolutely.
Right. So Kim, if you have that, then have somebody take a look at it. All right, we have one more question. This is from Robin, who also sent her question in by Twitter. There were 4 cases of H1N1 mutated viruses reported in North Carolina. Should we be worried?
Well, listen, people are on the lookout for that because this is what viruses do. They change, they evolve, they mutate. These particular cases became resistant to Tamiflu, which is the big medication that is used to treat H1N1 influenza. So we are expecting it to evolve a little bit. What we're looking for is more widespread resistance. Obviously, that hasn't happened yet. And remember, as viruses mutate or evolve, sometimes they become weaker. So it's not always a bad thing.
And viruses do just mutate. That's what they do.
Exactly.
All right.
All right.
Dr. Ashton, thank you very much.
Always a pleasure.
Dr. Turner.
Yes.
Why don't you make your way over that way?
Okay.
Slowly down the stairs.
That's right. Easy down the stairs. If you have a medical question for our Dr. Ashton, you can connect to her via Twitter at the Twitter site or earlyshow. What's so funny? CBSnews.com.